I'm still having problems with incontinence. One of the great things about the surgeon that's looking after me is that he has a team of people that provide support for incontinence and sexuality and those sort of things that you need to adjust your life to. And there's still some adjustment going on there after 8 weeks, but I'm seeing a pelvic floor physiotherapist and I'm on an exercise routine, and that's helping, and day by day it's getting better.
Most men will have some form of incontinence following radical prostatectomy, and that might vary. They might have symptoms of stress incontinence, which means every time they cough, they sneeze, get up out of a chair, bend down to put on their shoes, they might leak some urine. They might have symptoms of urge incontinence, which means that when they have a full bladder and need to get to the toilet, they might be leaking on the way. They might have one or the other, or a combination of both. They will often complain of frequency of going to the toilet, waking up quite a few times at night. After the catheter's been removed and after the surgery, some men will come in and have no incontinence problems whatsoever, while some might have quite marked incontinence, filling up many pads through the day and night. Recent research has shown that men that are taught pelvic floor exercises prior to their surgery actually do better post-operatively as far as their incontinence is concerned. So I will see men once before their surgery, and then I see them once the catheter has been removed for an extensive exercise program. Apart from the exercises, as part of my treatment, learning how to use the lower abdominal muscles is very important because they do work with the pelvic floor muscles. So I will give them strengthening exercises. It's another way of working with their pelvic floor muscles, is that I give them strengthening exercises for their lower abdominal muscles to be worked with their pelvic floor muscles. Doing yoga, Pilates, Tai Chi is a really great form of exercising these muscles as well. Posture is another aspect that we look at, because if they are slumped or sitting badly, they might leak, where if they're sitting in a good upright chair, their pelvic floor muscles will work while they are sitting upright, because they work with postural muscles as well. Well, at the Prostate Cancer Rehabilitation Centre and the men that I see, most will get dry anywhere between 6 weeks after their surgery to 3 months after their surgery. Occasionally there might be someone who takes a bit longer. Really depends on how motivated they are to do their exercises and to keep up with the program.
A small percentage of men who've been treated for prostate cancer do suffer with persisting major urinary incontinence. These men will not respond to pelvic floor training, and it is very important that they are not left permanently incontinent. There are 2 surgical options for management of these men. The first is the insertion of a male sling. This is an artificial device that's inserted surgically and exerts pressure, an obstructive pressure, on the urethra, which is the tube that drains urine from the bladder. The results for the male sling are not entirely predictable. For men with a more moderate degree of urinary incontinence, there may be a beneficial effect from the male sling. However, for men who don't respond to the sling or who have very significant incontinence, the artificial urinary sphincter is the gold standard way of restoring good bladder control. This is an operation whereby a small cut is made in the scrotum under a general anaesthetic. An encircling cuff is placed around the urethra, and that cuff is connected to a small pump within the scrotum and a small reservoir of fluid that is placed behind the abdominal muscles. This device is totally within the patient. There is nothing external. What happens is that the fluid in the encircling cuff compresses the urethra and prevents leakage. When the man wants to pass urine, he simply squeezes the small pump in his scrotum. That opens the cuff, allows his bladder to empty in the normal way, and then automatically refills the cuff over a 2 to 3 minute period. This is an excellent means of restoring bladder control for these men.
As a urologist with a subspecial interest in both male and female urinary incontinence, I certainly have seen a lot of men, especially during my fellowship training in North America, with post-prostatectomy incontinence who have not sought help for their incontinent problems for quite a number of years, not realizing that there are actually good and effective treatment options available. So therefore, I would like to encourage those men who do suffer from post-prostatectomy incontinence to discuss or raise this issue with their surgeon and seek the appropriate treatment options as available.
I think men need to know that at any stage they can start an exercise program. There are physios that deal with this area, or there are continence nurse advisors as well that could help them. They need to know as well that it is not a quick fix. It might take many months to build up the muscles and use them functionally so that they can see a difference in their incontinence. But in the small percentage of men that it doesn't work for, then there is alternatives and there is surgery, and they can have a artificial urethral sphincter put in or a male sling, which will help them. And I think it's important for men to know that they don't have to live with incontinence. There is help out there, and they can lead a normal and active life.
Well, after having the prostate removed, I had big problems with continence. I was off work approximately for about, I would say, 8 weeks, but I went back to work and I did have problems with the incontinence. I had quite a bad lot of leakage. I wore a pad to work and the incontinence was pretty bad. I would probably change that 3 times a day, and that became a bit of a problem for me. I went back to the specialist and spoke to him about these, mainly the incontinence problem, because it wasn't getting any better. I had physio, I did the exercises, and it still didn't improve at all. So I had a sphincter fitted, which has been excellent. I still get a little bit of leakage at work, particularly under a bit of stress, but generally it's very, very good. I would recommend it to anybody to have it done.